access to quality health care is no more a luxury ordinary people cannot afford, following the revival of the National Health Insurance Scheme.
Following its establishment in 2003, the National Health Insurance Scheme was intended to provide equitable access and financial coverage for basic health care services to all Ghanaians. But more than 2 decades after its establishment, the scheme appears to be struggling. At the Kolebu Teaching Hospital, which is the nation's biggest referral health center, patients from far and near come to receive medical care. However, quality health care here comes at a cost, even with a valid national health insurance card.
Most of the drugs I've been told to buy are not covered by the National Health Insurance Scheme.
Meet Cecilia Borden. Her son was knocked down by a car in the central region where they reside. He was rushed to the Fiankwanta Hospital in the western region. But the son had to be quickly transferred to the Kolebu Teaching Hospital owing to the severity of his injuries. Cecilia shares how she has had to pay more money than she thought she would after being told the health insurance does not cover most of the medication needed for her son's treatment.
Initially, I was told the health insurance does not cover the cost of that drug, until the chemist informed me it is indeed covered by the National Health Insurance Scheme. Since then, I have paid for all the drugs that have been prescribed for my son. You make almost by 300 million because I do not make a boy do much 5 million. A boy says, my martin look 2 million.
In one of the corridors of the hospital is a pensioner and former staff of the Kolebu Teaching Hospital. His old age and deteriorating health means he frequents the hospital for medications and health advice. But he's worried his National Health Insurance card does not cover the cost of most of his medications. He often has to postpone his doctor's appointment, even at the risk of complications if his pension fund does not hit his account early. Without it, he wouldn't have the cash to cover his medication costs at the hospital.
It's only effective when it comes to consultation. When you have to see the doctor, you don't have to pay anything. But when, after seeing the doctor, other facilities around, that's where you have to pay. Some of the expensive drugs, you'll be asked to go and pay. It's only the common drugs which are common, BP, paracetamol, and then it is Bico or any other drug. But when it comes to the expensive ones, you are forced to go and buy, and it is likely that's the only medication which can save you. And formally, when I'm a GU patient, when I go, the drugs that can be provided is being catered by the National Health Insurance Coverage. But for some years now, when I go, they only give me one of the drugs, and then the other ones I have to go and buy. When you go to X-ray or you go to lab, when there are expensive tests to be done, it's also, you have to pay. If I'm even to pay to see the doctor, what do I do? If I don't have, what do I do? Which means before I come, I have to get money to come. If possible, I'm being paid and I'm not well, I have to wait when I'm being paid before I can come. And if I'm to die, I'll die.
In 2022, the National Health Insurance Authority added treatment of 4 childhood cancers to the National Health Insurance Scheme's benefit package. But several concerns continue to emerge about the effectiveness of the scheme and why it no longer covers the costs of some of the most basic diseases.
I think it's wealthy because looking at initial, when you come, you can use it to access a lot of things. Now you can actually use it to pick your card, right? And some of the drugs too covered. Because I remember when I even brought my father, the drugs, it covered it. So we're actually happy with it. And the cards too, normally if you are supposed to pay 100 cedis or something, now it's reduced to 50, or some of them even 30, some of them 15, depending on what you are coming to do. So with the lab issue, that's a problem for me personally I have, because after the doctor have seen you, the consulting is also part of the insurance. It clears it. But the most important for me is the labs, because sometimes I think I heard that the labs can also be covered, but I realize that when you come, it's different. It doesn't cover.
Belinda Quay is a mother who brought her sick daughter to the Kolebu Teaching Hospital for treatment. But her heart sank when she learned that most of the medicines the doctor prescribed for her daughter were not covered by the health insurance scheme.
I usually use the national health insurance for my card, but when I'm about to do the lab, I pay the H3 too. I paid, so I can say it's only for the card, because for the H3 I paid, the lab too I paid for it. I came here yesterday. Today we are just come to pick our card. We pay 15 cedis. They say because we have insurance, that's why we pay 15 cedis.
For the card?
Yeah, but yesterday we did another new card. But when we are coming today to see doctor, they say we will pay 15 cedis before we will take our card again. So I don't know whether because of insurance we pay 15 cedis, or if no insurance we will pay more than that. As I'm talking now, they've given me another lab and another H3, but all are not under insurance. I have to go outside and do it and bring it on Tuesday. So I don't think it works in other ways, but maybe for other people it works for them. Because I have H3 to do right now. I have this thing and the lab. Oh, here is it. I have an H3 to do and lab. This one, private, they asked me to go somewhere and do it. This one, they said I should go to Kolebu, the main one, and do it. But I have to get there and see whether the insurance will cover it or not. But as for this one there, I'm going to do it outside. So the insurance doesn't cover it for me.
In the various parts of the hospital, patients continue to feel the pinch as they are asked to pay either extra for services at the hospital, or the scheme does not cover some basic services they expected it should cover. Kenneth Jesse, Joy News, Accra.